New Orleans Health Innovators, or NOLA High, is a wonderful program that is focused on making sure that the city of New Orleans becomes a mecca for bioinnovation and digital health companies. And so this is an opportunity to introduce New Orleans, all our assets, whether it's a great hospital systems, great educational system, a tremendous tax incentive and digital media software development tax incentive to help companies understand that New Orleans and all of Louisiana is a place for business.
Blue Cross is involved because the company's mission is to improve the health and lives of all Louisianians. And so the NOLA High Challenge is really important to help us look at the factors that affect everyone in Louisiana and help to find new innovative solutions to those problems.
In the current climate, in the face of the pandemic, the impacts from COVID-19 have been substantial. There are individuals who already suffer from the impacts of social isolation, some of which are, more restrictive prior to the induction of the pandemic. And so this is particularly important as a new set of innovative technologies that can help to reduce that barrier.
I do estate planning and business succession planning. Most of my clients are older, and isolation has been terrible for them. They're not getting to see their grandchildren. If they're not working full time, they're getting very little socialization at all. And it has other side effects, that can be dangerous as well as the disease.
What I'm looking for as a judge is to understand that there is a significant problem that is addressed, or the solution has a reasonable probability of addressing, and then having some sort of a business plan that'll allow the company to actually be sustainable in order to deliver their solution.
My name is Jeanette Weiland, and I am the Vice President of Bio, Innovation, and Special Projects at the New Orleans Business Alliance, otherwise referred to as NOLA BA. Today I'm joined with our President and CEO, Mr. Quentin L. Messer Jr. Hello, Quentin.
Good to be back again.
Yes, this is great. Are you excited for today?
I am. In fact, I have my hunting pants on because we know that there are companies hunting for money. Let's do this.
I love it. I saw the ducks. I wanted to ask, but I'm glad you owned it. Well, as we just saw in the commercial a moment ago, this year's challenge statement was written by Blue Cross Blue Shield of Louisiana and Ochsner Health a year ago. And originally it was phrased as finding a solution for social isolation in the aging population. However, I think now more than ever, this is extremely relevant, and maybe they were ahead of their time.
Yeah, sadly, obviously social isolation for older folks has always been a challenge, and now we're all dealing in this pandemic moment. But I believe, and this is why I'm so honored that the Business Alliance is working with Blue Cross and Blue Shield of Louisiana, Ochsner Health, and the other companies that are sponsoring this, as well as the contestants. We're going to use this tragedy to create a triumph. And I think that one of the companies here could potentially have a solution that can help deal with social isolation, not only if there's a future pandemic again, but just in general, as we are learning so much because of what we've experienced over the last 6 or 7 months. Mental health and connectedness is so important.
Okay, well, as we begin, I'm going to go ahead and take this time to introduce our judging panel to you, the audience. We have Amy Quirk, CEO of Innovation Ochsner, Dr. Richard Milani, Chief Clinical Transformation Officer at Ochsner Health, Dr. Jeremy Wigington, Medical Director of Population Health Analytics and Network Innovation at Blue Cross Blue Shield of Louisiana, Tina Bourgeois, Vice President of Analytics and Data at Blue Cross Blue Shield of Louisiana, Dr. Kenny Cole, System Vice President of Clinical Operations at Ochsner Health, Dr. Trivia Frazier, President and CEO of Obatala Sciences, Scott Whitaker, Partner at Stone Pigman Walther Whitman, and Laura Plunkett, Practicing Member of Stone Pigman Walther Whitman. Thank you to all of you for taking the time to participate, and we are especially excited to see the breadth of the perspectives that you're going to bring to judging this competition. Okay, well, if everyone's ready, we'll go ahead and get started. The first company that we'll present is named Helpful, and representing Helpful is Miss Jenny Gallagher. Jenny, you will have 5 minutes to participate and present your pitch to the judges. When your time is up, we will implement a hard stop and turn it over to the judges for a 5-minute question and answer session. Jenny, best of luck, and please begin when you're ready.
Thank you. So a few years ago, sorry, I'm just checking to make sure you all can see on my screen. I'm using the two computers. So a few years ago, my mom, who was in her 80s and lived 3,000 miles away from me, alone, called me. And she confided in me just how empty and lonely her life was. And, it was a heartbreaking moment. And, when I look at today, in light of COVID, I suspect that many of us actually are experiencing the same social isolation and feeling of loneliness. So it's not surprising that this sector has actually doubled since 2018 and is costing Medicare $50 billion in additional costs. My name's Jenny Gallagher, and I am the co-founder and CEO of Helpful. And we're on a mission to wipe out social isolation and loneliness in an older age by empowering people to be able to fill their lives with more help, purpose, and connection. Helpful is a community network where members of all ages can get and give practical help. So that could be help around the house or with meals, rides. It could be to share skills and experience, like with personal technology or how to cook the best Thanksgiving turkey, and just to share common interests. The way that Helpful works is a member signs up and they complete their profile, and they then can post listings, and the listing could be an offer of help or a request for help, and it could either be virtual, it could be socially distanced, and once we get past COVID, it could be in person. Members that post their socially distanced listing for the first time go through a background check. They then are matched with other members. They select one for their visit. Their visits are then confirmed. And then after the visit, time tokens are exchanged, as well as members have an opportunity to rate their experience and even to send each other an appreciation note. So you might be wondering, what are time tokens? So one time token is equal to 1 hour of help. So every time one member helps another, they get time tokens. And time tokens can be used to get help. They can be used to learn something new, given to family and friends, or donated to Helpful's community fund. And if members need more time tokens, they also have the option to buy more. Our approach is unique in a few key ways. So unlike expensive fee-for-service options like maybe a Papa or Care.com, Helpful runs on time tokens. So members are able to use time instead of money in order to get help. And secondly is our reciprocal system. So members not only can get help, but they also have the opportunity to give help. And we believe that everyone has a superpower. So this means that anyone can conveniently fill their life with more purpose, which is a very powerful antidote for social isolation and loneliness. And then finally, our recommendation engine makes it possible for members to have to be able to connect with others with whom they're compatible and share interests in order to lead to more meaningful experiences. Our approach is working. In addition to completing 1 acquisition and 3 pilots with 1,200 participants and having 83% of those surveyed rate their experience a 5 out of 5, we're seeing some very promising results. An independent evaluation was done after Sutter Health's pilot that indicated that members who were 60 plus experienced a 20% lower outpatient healthcare utilization and costs after joining the community network. The opportunity is very large and growing rapidly, and our business is a B2B2C SaaS model. So the exciting thing is that while we're a two-sided marketplace, we're one with a distinct advantage. About 50% of our members engage in both sides of the marketplace by both giving help as well as getting help. And the way that we scale in a new market starts by building an anchor relationship with a provider and payer. And in particular, we're interested in full risk Medicare Advantage programs. And then next, we partner with employers as part of their wellness or their corporate social responsibility program. And then finally, we partner with community organizations and colleges to be able to further fill in the community. Helpful for Healthcare is about bending the health curve as we age. So we're able to tailor programs based on specific populations that are then able to deliver specific impact as well as outcomes. And based on our preliminary data, we're confident that we'll be able to partner with healthcare organizations to achieve a strong return on investment. And finally, we have the right team to make Helpful a success. Before founding Helpful, I was a senior executive with AARP. I met my co-founder and CTO, Shamshad Khan, when we worked together at AAA, and we've rounded out our expertise with some terrific advisors, including executives from Humana and Sutter, as well as the former chair of AARP. So I invite you to join us in this important mission, and thanks very much for your time.
Jenny, thank you very much. That was wonderful. Right now, we're going to give 5 minutes for our judges to ask questions.
Hey, Jenny, great presentation. Could you explain a little bit more about your business model and who pays, with including the people who are getting help? How much do they pay for time tokens, and the providers? What's their financial participation?
Right. So, as I mentioned, we're primarily focused, we're B2B2C. The B2C part of it is that it's a community. The more that are on the community, the better. And so just starting with that part of your question, we do have, sort of a B2C type of a subscription. So there's a free level. You can buy a more premium type of level. And right now during COVID, you can buy time tokens, and we're doing sort of a pay-as-you-wish model. We don't want people not to be able to get the help that they need during COVID. But, we're looking at fractions of what you'd pay. If you were to use like a care.com, we're going to be a matter of, in the single digits, so for time tokens. So it's going to be very affordable. That's one of our goals. And really the opportunity, both in terms of the business model as well as the opportunity to scale, is to then again have enterprise customers such as providers and payers. And there it would be to have a group membership, one where we can customize a specific population. It could be, again, those are seniors who are socially isolated, to be able to say together, how can we customize a program to get the right kind of engagement in order to drive the right type of impact and outcome. So it might be creating certain incentives, to help target that population to ensure that they're engaging so that we can realize the types of benefits that Helpful can provide in terms of alleviating social isolation and all that goes with it.
Thank you.
For individuals who may not feel like they have anything to offer, so an elderly individual who would love help but just feel like they don't have the skills or the knowledge to contribute, what do you do to engage them and to maybe bring them in to feel like they do have something to offer and contribute?
Yeah, so part of it, one option also is a concierge level where you have sort of a coach or a buddy, right? It can be both for outbound calls, but also someone to help you successfully tackle exactly that kind of a question. It's like, oh, I have nothing to offer. I'll give you one quick example. We had a woman in her 70s with a degenerative neurological disorder in a wheelchair. And she was using Helpful to get help, like taking her cat to the vet. And she really liked the person that she was connected with. And when she learned about, this idea of reciprocity and time token, she's like, well, look at me, I'm in a wheelchair. And we knew from her profile that she had spent 30 years as an editor on Madison Avenue. So we're like, gosh, you're 2 miles from UC Berkeley. Maybe there's something you can do, because cognitively she was, completely there. And so she has moved on and helped another member edit their first book. So, there's the opportunity to make sure to help people sort of discover what is their superpower.
Jenny, you mentioned that you have a relationship with both Sutter and Banner Health. Are they looking to expand your program?
Yeah, Sutter Health. So we're focused primarily here in the Bay Area right now. We will, be growing in Phoenix, but right now we're focusing in Sutter. So absolutely, I actually talked to one of our sort of key cheerleaders at Sutter last week, and so our plan is beginning of the year, as everyone's starting to pull their nose up and anticipate the next chapter beyond, not beyond COVID, but in COVID, of looking for ways. So we, pre-COVID, had conversations with about 3 different areas of Sutter who are interested in getting going with us, including their Medicare Advantage, community health, and post-acute. So those are all opportunities that we'll be pursuing in the new year.
Jenny, just building.
Jenny, thank you so very much. And unfortunately, you did have more questions from the judges, but we have to stick to the rules to keep it fair and equitable for everybody. So unfortunately, we're out of time. That was fantastic. Best of luck to you. Ladies and gentlemen, our next presenter is the company named Happy. And representing Happy is Mr. Jeremy Fishbach. Jeremy, you're going to have 5 minutes to present your pitch, after which the judges will conduct a 5-minute Q&A session. Jeremy, best of luck, and please begin when you're ready.
Thank you. It's an honor to be here. Happy, which happens to be based in New Orleans, is a scalable solution to social isolation among all age ranges, certainly with a focus on older adults. Social isolation, as we all know, is a symptom of breakdowns in people's primary support systems. And Happy helps people build new ones quickly, effectively, over long periods of time. We're all very familiar with the problem. Happy articulates the problem as really epidemic deteriorations of primary support systems. 50% of the country feels alone, unsupported. Actually, younger generations are the most isolated, and older adults follow. As we've discussed, people who are lonely and unsupported don't take care of themselves. Their physical and mental health suffers. It costs insurers billions of dollars and makes a lot of other interventions less successful when a person's lonely, unsupported. And I'll just say it was my personal experience with a prolonged bout of loneliness after a divorce that inspired Happy, the solution. So Happy helps people build new primary support systems. How do we do this? First, we've built a national network of compassionate peers. We call them support givers who have meaningful healthcare experience in community health, peer support, some cases social work. They're also statistically exceptional at providing the essential ingredient of mental health, which is emotional support. It's an extraordinary community of people. We've vetted thousands across the country now, and our technology simply allows people to, at the push of a button, connect, reconnect, and build ongoing supportive relationships with our support givers. Our tech includes a mobile app, which you can see here, toll-free access, inbound and outbound calls, increasingly intelligent matching algorithms, and also data and analytics that we're feeding into our partners. It's also turnkey. So when we go live, even with the major payers we have, it's a matter of a week for us to go just from procurement to go live. The D2C cost for this is $24 an hour, so it's an extremely cheap service. This is one of our amazing support givers, Ashley, and who's a little younger. A lot of our support givers are older adults, and so to the point, just referencing the last presentation, which was great. A lot of our support givers are older adults, and we're addressing social isolation on that side of the service as well. KPIs, I'll just say after thousands of calls, we know that people who use Happy feel significantly better. Our average call rating after thousands of calls is a 4.85 out of 5. So almost every experience goes well. Callers report an average improvement in mood and around 45%, an average decrease in anxiety of close to 50% for a single call. It's a little harder to see on a PowerPoint, is that we're literally changing and in some cases saving lives for many callers who are not suicidal, can't afford therapy, and don't have family and friends. Happy support givers are literally their only source of social support in the world. This is a dual eligible case study, but I'll just move to our partnerships. We launched a few months ago, most notably with Centene WellCare in their largest market, Florida, now serving 2.5 million members. We've done extremely well. We're now expanding that into a larger partnership with Centene WellCare, with other Medicaid plans, Medicare plans as well. Briefly, I'd say in essence, Centene WellCare has tacked Happy on to the beginning of their continuum of care. We're helping them accomplish a lot of goals, addressing social isolation at scale, addressing a whole range of behavioral health issues at scale. In fact, the members we're serving have all been diagnosed with depression or anxiety over the last 60 days. So it's very much isolation wrapped up with behavioral health. We're significantly increasing member engagement for them. We have 30% engagement rates over the last few months. We thought we were going to touch a few hundred members in this pilot. It's going to end up being tens of thousands. We're conducting mental health assessments, PHQ-2, GAD-2, social determinant screens, and we're making dynamic referrals, hundreds of them, back into the plan. We're really ingrained into the workflow. And now, as I said, we're moving on to partner with them and other colleagues, other plans of theirs. Last but not least, I'll say that Happy is a resource for not just payers, but for providers and others. We just launched with our first health system in Georgia, and now we're in discussions with another major health system in New Orleans. And isolation pervades frontline workers too. We think for a healthcare system to be properly, effectively supporting the population, they need to be supported as well. And so now we have an increasing list of health system customers in our pipeline. We're also going to be partnering over the next few months with quite a few assisted living facilities in states that have been particularly hit hard by COVID-19.
Jeremy, I hate to interrupt you, but we are out of time. Thank you so much. That was the virtual hook coming to pull you off stage. So thank you again. And now I'm going to turn it over to the judges for a 5-minute question and answer session. And Dr. Frazier, looks like she's up.
Excellent presentation. Can you talk a little bit about your competitors? How would you compare your app to, say, apps that are available for on a psychology sort of interaction, particularly those that are sort of more of the one-to-one, reach out type of issues, if there's sort of an intervention hotline or something that is essentially used through the app basis?
That's a great question. I mean, number one, we're in the peer space, so we tend not to focus on apps that make traditional therapy more available. This is a very human problem, and Happy is a very human solution. So I think that we distinguish from certain competitors by just the primacy we place on genuine supportive human connection. So this is not just a text-based service, and I think the other main thing is that we have a D2C component. Anybody can use this. We're trying to make this type of support widely available, but we have a lot of payer savviness in our team. My partner is the former national head of innovation at Aetna Medicaid, and so I think we see Happy as a solution across a lot of age ranges, a lot of verticals. Tell me if that answers your question.
Yes, to some degree it does.
Okay.
Thank you.
Okay.
Jeremy, how does an individual get introduced to Happy? So on the, let's just go with the Florida example in the Medicaid population. How would they find out about Happy to reach out to use it?
Two sources. Number one, they're doing a lot of I'll say socialization, education among their care managers. So we get a lot of referrals now from within the plan. And then second, we do outbound calls. So we're just getting lists of tens of thousands of members. And I would say 90% of the members we're reaching are through proactive outreach, a lot of whom are now cycling back through inbound.
Jeremy,
of the outbound,
thank you.
Go ahead, I'm sorry.
Go ahead, Rich. Finish up.
I was say, of the outbound calls, how many do you think are accepted? It's in terms of, I'd like to talk to you. As a cold call coming here.
Close to 35% now, after thousands of calls.
Thank you.
So Jeremy, I know that you're focused, or part of what you're focused on is serving a Medicaid population, and just interested about how you're able to, how the app solves some of the issues of health literacy and digital literacy, and how you've been able to address some of those gaps and barriers.
Yeah, I mean, the main thing is that it's Happy's more than an app. I mean, a lot of people using Happy are not even aware that we have an app. I would say 95% of the population that we're reaching in Florida is calling Happy through a toll-free number, or we are calling them on their cell phone. So the app is basically irrelevant to from a member's perspective. We do see a lot of potential, Amy, for the app to drive engagement, and we partner with the American Nurses Association, American Heart Association, and a lot of organizations where that is the predominant way people are encountering Happy, and there's more to do there. But we know with payers, in particular Medicaid, Medicare populations, we simply wouldn't have gotten this contract with an app if that was it.
So no one's asking a question. I'll go ahead and say this. Oh, sorry. I think you had a question. It's great to know that, and what it sounds like is you're bringing an experience more than an opportunity to just engage through an app. And so I would say lead with that. That was awesome. That's outstanding that you're bringing that.
I apologize. Yeah, you're absolutely right. I mean, frankly, we believe that apps and smartphones and everything that comes with them are a large part of the problem. And so we're really focused on just that human connection that is so critical to mental health and eliminating every and all obstacle. I'll also note, I can't remember whether one of you asked this, but the way that we work with payers is a very simple subscription model. Centene WellCare is just paying for different tiers of different volumes of calls, so it's quite simple.
Jeremy, thank you so much. We're out of time, unfortunately, but best of luck to you as contestant number 2 in the 2020 NOLA High competition. The third and final competitor for the Blue Cross Blue Shield and Ochsner Health competition is a company named Mon Ami. Mon Ami is going to be represented by Madeline Dangerfield-Cha. Madeline, you will have 5 minutes to present your pitch to the judges, and then the judges will conduct a 5-minute question and answer session. Please begin when you're ready, and best of luck.
Thanks so much, Jeanette. I'm excited to be here sharing about our approach to ending isolation. But first, a story. So this is Ralph. He's a retired French professor from Stanford. He's also a gentleman who has dementia from Parkinson's disease. In 2018, I started helping him write his memoir. His wife, Claudie, saw a post I made on Nextdoor, the local social network. Once a week, she put out cookies and tea in a teapot with matching cups and saucers. Ralph sometimes searched for the right words, but he still managed to transport me to France on the hunt for freshwater mussels, to ski slopes in Lebanon among the cedar trees, to a sabbatical in China where Claudie was teaching French, but really her students wanted advice on how to marry an American. Our time together was the highlight of my week. Ralph is one of hundreds of seniors Mon Ami has had the honor of serving in the last 3 years. Most came to us through a caregiver, a spouse, or an adult daughter, because of dementia due to Parkinson's disease, Alzheimer's, or other cruel thieves of personhood. Meaningful, long-lasting connections are crucial for these individuals when the world can otherwise be so overwhelming. So we found other students with the same energy and passion who were matched with seniors for painting, video gaming, language lessons, and long walks. We built administrative software and a mobile app to handle screening, background checking, and matching of new companions, like the Uber or Lyft of senior companionship. When my co-founder Joy and I graduated from Stanford's business school, we made ending loneliness our full-time jobs. Her background is in aging and healthcare. She's worked for the World Health Organization's aging team in Japan and has been a hospice volunteer since high school. I was raised by a single mom and maternal grandmother. Intergenerational connection is in my blood. We did over 10,000 hours of visits on our platform, and we're just starting to take off with coverage from Good Morning America and the New York Times and The Guardian, and then COVID hit. Of course, we all know the sudden and terrifying prospect for seniors, particularly those in nursing homes where more than half our clients lived. Though we couldn't visit in person, we threw everything we had into virtual support. Video calls, virtual chair yoga classes, errand runs for groceries and other essentials. But like everyone, Clearly, in-person visiting with seniors would be out of the question for the foreseeable future. Our revenue had dropped to zero overnight. It seemed our mission was doomed just when it mattered most. Then we got a call from the San Francisco mayor's office. One of the staff members there, Claire, had seen our app in action because her partner had been a companion with us pre-COVID. San Francisco's dozens of senior serving organizations were underwater. Claire said they were receiving hundreds of requests per day for prescription pickups, food insecurity, and extreme isolation. But staff had no ability to track and manage these requests, let alone fulfill them with volunteers. That's where Mon Ami technology came in. Mayor Breed held a press conference announcing our partnership and posted a link to a volunteer application on sf.gov. Our partnership got over 1,000 volunteers onboarded in the first week. At the time, it didn't feel like a pivot. It felt like a simple calling. We had the technology and the willingness. It was not the time to be strategic. It was the time to jump into action. Claire opened the door to so much need. We set to work in partnership with nonprofits, healthcare providers, and city officials, processing requests, posting them to volunteers nearby, running rapid trainings, updating safety protocols. Robert and his partner Jim ran low on their stroke medication. It was picked up and dropped off at their apartment within 3 hours. Cantonese-speaking volunteers went to specialty markets and swapped recipes with a mostly Chinese community housing project. Volunteers donated old tablets and iPhones, helping seniors join Zoom calls from a safe distance. Of course, our technology needed some updates to support this mostly remote and virtual work after 2 years of designing and developing around the in-person experience. For example, all of the heartwarming photos you've seen so far came from actual visits. After every session, companions would submit a visit story, photo, and description to be shared automatically with a caregiver. Social workers and other staff at our nonprofit partners and healthcare providers were asking for the same level of visibility after volunteers made phone calls or completed errand runs. For example, one volunteer, Daniel, was unable to reach his senior match, Rhonda, even after showing up at her apartment for a delivery. Daniel notified Rhonda's supportive organization, Open House, where a social worker was able to connect to Rhonda's neighbor, who discovered that Rhonda had fallen and wasn't able to reach her phone. Rhonda was rushed to the hospital. Information from these volunteers is saving lives. We updated our recap process to make it as simple and straightforward as possible for volunteers to complete.
Madeline, unfortunately, we are out of time, and I hate to do that at such an impactful moment for you. That was fantastic information. That concludes your 5-minute pitch, and now we're going to turn it over to the judges for a 5-minute question and answer session.
Hi, Madeline. That was great.
Hi,
Thank
everyone.
you. You mentioned that members with dementia were a population that you could serve. Could you talk a little bit about how your interface reaches those members with those types of medical conditions? You know, is there adaptations that have made? Are you reaching the caregiver? And then sort of a second piece of that is, are you marketing it to the individual, or are you marketing more to payers or caregiver organizations?
Great questions. So we developed around the caregiver experience. So a lot of our technology faces a family member, though it is accessible to independent seniors who use it directly. But similarly to other solutions that we've talked about today, all you need to interact with a volunteer through Mon Ami is a phone. So you don't need to be able to book things online. A community service worker or a care manager, the health plan can coordinate that work for you using our software. But it really was crucial to us that folks with dementia gained access to this social interaction, which is so hard to come by. And the pivot I was describing, which in the later slides, I just would have described a little bit more about the fact that we were a direct-to-consumer, paid model, and now post-pandemic, we're coordinating exclusively volunteer activities on an enterprise SaaS model. So healthcare entities and city governments and nonprofits are paying anywhere from a few $1,000s to $100,000 a year, depending on the scale of the needs that they need to serve. And they're using our software both to coordinate and to track and report on all of these instances of volunteering between a young person who's, safe to go out and get groceries and get prescriptions, and a senior who's sheltering in place.
Madeline, great presentation.
Thank you.
Can you talk a little bit about how you screen your volunteers, especially these seniors with dementia or onset of dementia? It's a very vulnerable population, so I'm curious about that.
Yeah, it's one of the benefits of working with us for the organizations that we partner with is that we ran this as a direct service organization for 2 years before this pivot. So we have an online application for volunteers that leads directly to a background check and then an online interview over Zoom, and we check 3 references. So all of that screening and tracking is built directly into the software. So any organization that's really working hard to spend all of their time serving seniors and clients doesn't have to think too hard about how to spin up the volunteer management side. And then once you have this pool of vetted volunteers, the software is giving you the tools to manage and motivate those volunteers by sending them rewards and thank you notes and little celebrations through the software to really thank you for your work. And it really is very app focused for the volunteers. Most of the volunteers are between the ages of 22 and 30, and they love being able to open their phone, find an opportunity to help, and go do it right away.
Madeline, how do you see your solution scaling in more rural areas?
Yeah, we actually are beginning to partner with a really rural county in Utah as we speak. And what we hear in all of the needs are everywhere. And there are amazing community-based organizations that have been serving them for decades. And they've been doing so without the benefit of a lot of technology to make that easier. But all you really need is a phone and the ability to track those calls. So we have a phone system that keeps the volunteer and the client's phone numbers private, but we can track that the phone calls are taking place, knowing that someone's checking in. They can use our software to get reimbursed for groceries that they buy out of their own pocket to deliver to a senior nearby. And in those rural areas, we see volunteers who are willing to drive 20 or 30 miles to get someone something they need, where in a city, we're able to geo-target and get somebody matched within just a few blocks. So it just scales depending on the needs of the community, but all of that emotional connection that's required to make it work is already there. We're just helping to make it easier.
Thank you, Madeline. That is the end of our time. Fantastic work, and best of luck to you as well. Ladies and gentlemen, that concludes the formal pitch portion of our 2020 New Orleans Health Innovators Challenge, brought to you by Blue Cross Blue Shield of Louisiana and Ochsner Health. A special thank you from the New Orleans Business Alliance to our sponsors for making this happen. Now, if you'll stick with me, the judges are about to go into another room, or at least the ones who are here in person, and they're going to safely distance, keep their masks on, and deliberate in person to determine who is going to be the winner of the 2020 NOLA High Challenge. Welcome back, everyone. The judges are still deliberating, and I'm still on set, and now I'm joined by Quentin again. How are you?
It's good to see you. I missed you.
I know, it's been so long.
You kicked me off.
What did you think of the pitch competition?
I'm always amazed by how bright and creative folks are.
Absolutely.
It just makes me realize I'm probably sitting in the right place,
right.
Not trying to compete with them.
Absolutely, I know, and I'm always of the mindset where I want everyone to win. Well, I have a very exciting item in my hands right now. The fans have made their statement. They've chosen a winner.
Okay.
Are you ready? Should I open this?
Let's do it.
Okay. Let's see who the fan favorite winner is. Yes, drum roll, thank you. For the 2020 NOLA High Blue Cross Blue Shield of Louisiana Ochsner Health Challenge. Mon ami, congratulations, Madeline. If you're here, if you can hear this, you are the fan favorite. That is wonderful news, and we have picked out, we've curated a New Orleans treat for you. So I'll just show you really quickly. New Orleans also has a great industry when it comes to food and food manufacturing and products, and so I can see some camellia red beans and some Ouidat spices and some Tabasco and Zapp's potato chips and all sorts of good stuff. So congratulations. We will make sure this finds its way into your hands, and best of luck for the big pitch competition. Have you been given your Oscar envelope, Quentin?
I do. I wanted to kind of have some drama.
Okay.
I mean, because I
yeah.
feel important for like 2 seconds.
I know. You are.
Well, let me see, because I realize I want you to see it too. Make sure.
That makes me.
Are we ready?
Yeah.
Should we go ahead?
Yeah.
The winner of the 2020 pitch competition is Jeremy Fishbach at Happy.
Congratulations, Jeremy. Congratulations. I was trying to be cheesy and say that makes me happy. So we'll see if we can get Jeremy on camera if he's not able to join us. I think he's going to join us. Let's see if he's there.
Come on, Jeremy.
We wanted to see the initial awesome reaction, Jeremy. This is killing us. The suspense. There he is. Hi, Jeremy. Congratulations.
Yeah, Jeremy. Congratulations. Yeah.
Thank you.
Well
Sorry.
done.
Glad to be having my technical difficulties at the end of this.
Do you want to say a few words
No.
to everybody watching?
Just thank you. This is a really serious problem. We're honored to be, working and competing against companies that are designing really great solutions for what I think we all believe is one of the most pressing challenges of not just the COVID era but beyond. And I just want to wish the best to Monami and Helpful. They're doing amazing work, and yeah, thank you to Blue Cross Auctioner, NOLA BA, and everyone who participated. It's an honor, and we're very grateful.
Well, we are so happy for you, Jeremy. Well done. Your hard work is paying off, and as Chris Cleel and I just discussed, you are impacting lives and potentially saving lives, and I can't think of anything more noble than that. So very well done. Now we just need to talk to you about setting up that office and hiring hundreds of people to serve all of your patients and your consumers here in New Orleans. That's our economic developer hat that we have to wear.
We're already working on it. Yeah.
All right. Well, we wish you great success. Yes. Thank you again for joining us.
That's cool.
I don't want this to end. What do we do? I just don't want this to end. This is such a great moment.
No, it is. But I have to say that I think all good things, if they don't come to an end, they come to a pause. But I want to, before we go, I want to congratulate all the companies.
Absolutely.
Tremendous, again, to the fan favorite and to the overall pitch favorite. But one last time, I really want to thank Blue Cross and Blue Shield of Louisiana, Auctioner Health, Tulane Health System, Auctioner Lafayette General Health, New Orleans Health Department, New Orleans East Hospital, Ujima Economic Development Corporation, Stone Pigman, and New Orleans Bioinnovation Center. And really to all my colleagues here at the Business Alliance, particularly you, Jeanette, and Valerie Huntley, who has been tremendous, and a tremendous team here. You don't realize it takes a lot to make me look good, or at least presentable, and there's a whole group of people. So thank you to everybody. This has been tremendous.
Yes, this is a lot of fun. Thanks, everyone. We hope to see you soon. Take care. Gosh, that was a tough decision. I mean, all three companies provided very different but very impactful and innovative solutions. I loved seeing, like Monami had a very, human-to-human kind of approach to it, which was fantastic. Happy's was different, because they were an app-based, but all of them, I mean, they just all really answered the call. I'm not supposed to be biased, but I will tell you, it made me extra happy that Happy's a New Orleans-based company. I thought that was really cool. Coincidental, but very cool that they won. I'm just excited. I think, the whole purpose is to see if these companies can get their technologies off the ground, get them in a patient setting, in a patient population where they're working with healthcare systems, hopefully ours, improving the lives of people here in New Orleans on the ground and everywhere, and then starting companies where they have to grow and they need to hire people, and we can help with that.
Oh, it was so exciting, and when he won, he was so emotional, and it was fantastic to be part of this. He's got a great product. It's very scalable, had a great business model. So, and in this environment that we're in today, it was just perfect. So.
You had 3 good ones to choose from.
Yes, absolutely. Mon Ami was awesome, and so was all 3. So, and they each had a distinct advantage that they could have brought to the table. So we wish all 3 of them a lot of success.
In partnership with Ochsner and we at Blue Cross are really excited that Happy, which is actually based here in New Orleans, was chosen as the winner. A little bit of a lagniappe that the winner was here in New Orleans, but Happy has really developed a solution that I think is going to be able to be scaled to really tough to reach communities here in the Louisiana region, and we're very excited to have this company as the winner because I think it's really going to make some important impacts into the difficult problem of social isolation.
I'm always amazed by how much talent there is out there in the world because this is becoming worldwide and we are attracting competitors from outside the U.S. So I'm always excited about that, and I think it speaks to a bright future for New Orleans in this area of digital health and bioinnovation.
I think the NOLA High project is very impressive. Every year, I've been here from the beginning. Each year it gets better and better. I'm very impressed with what's going on here today.
The NOLA High project has great potential to not only make an impact here locally, by supporting these innovative technologies as they come down the pipeline, but also to make an impact in the Southeast region and globally as these technologies are pushed forward and they are used and adapted by many of the places and individuals who can use them the most.
The NOLA High project is fantastic. It really gives an opportunity to give a voice to people who, otherwise wouldn't know how to present these fabulous ideas in a way to effectuate them and make progress.
Oh, this organization's tremendous. I'm so excited to have been a part of it this year, and I think that the future of it's incredibly bright, along with all of the businesses that they keep bringing to the table.
I've seen NOLA High kind of morph a little bit. So when I first came on board, we had just come off the first version, and there were 3 challenge statements. And the second year, when I first started, there were 4, and this year we had 5. And we really have so many institutions that understand the tie and the relation and the correlation between public health and the economy and good health care. Good meaning efficient and effective and impactful. Outcomes for patients are what really, really matter. And so I think NOLA High is a fantastic tool for that. I don't know that we're going to have the same format next year. We might try to morph and make more of a real-time impact, or at least, follow that story of a real-time impact. We'll see.
How can people get more information about NOLA High?
They can get more information about NOLA High by coming to the New Orleans Business Alliance website at www.nolaba.org, and then you can just search for NOLA High.